Hello, good afternoon, everyone. I hope all of you had your lunch already. Okay, so today we will be sharing on the topic of arthritis. So if you have any achy joints, it could be arthritis. So today we have our community nurse, staff nurse Amanda and staff nurse Christina. Senior staff nurse Amanda and senior staff nurse Christina, who will be sharing on this topic with you. So if you have any questions, do hold it, and then we will have a Q&A session at the last part of our health talk today, or you can actually type in your questions via the chat box as well. Yep, so passing over to you, Amanda and Christina.
Thank you, Felicia. Hi, everyone, and welcome to the Health Talk series in collaboration with Radin Masisi. Thank you for joining us. Our topic for today is aching. So my colleague is Senior Staff Nurse Amanda and myself, Christina. We are the community nurses from SGH. Also, we are the speakers for today Health Talk. Today we'll be sharing what is joint anatomy, the basic structure of the joint, movement of the arthritis, the types. Okay, this with arthritis, the chances of developing arthritis, when how you can manage. So the joint anatomy, the normal joint is where a point whereby two bones make a contact which able to make the body move about, and the function of the joint to hold the skeletal bones together, allow flexibility and movement, and the limit range of motion and produce stability. So let's try our Q&A, true or false. Arthritis can affect only older adult. Okay, can someone can try to answer? Anyone?
False.
Thank you for participating. The answer is no. Yeah, so arthritis is not only limited to older adults, where arthritis is more common among older adults. Arthritis develop in younger people also. So among adults aged 65 and older, 50% reporting ever have been diagnosed with arthritis. So what is arthritis? So arthritis refers to inflammatory of the joint. A person with arthritis will typically complain of pain and swelling in the joints. Both small joints such as those in the fingers and large joints such as knees and hip can also be affected. So here are the common signs and symptoms which a person with arthritis might be having. So pain, tenderness, especially when trying to move, swelling or warm area to touch, especially the affected joint area, redness, stiffness, limited range of motion. The person with arthritis unable to move like before, and some experience morning stiffness, more than 30 minutes. So let's try our Q&A. What are the different types of arthritis? Can anyone try? Okay, sorry, we can discuss in the following slide. Okay, so we have three types of arthritis, but we have two different types. We have degenerative, which branch to osteoarthritis, and we have inflammatory, which branch out to two, rheumatoid arthritis and gout. Okay, we shall discuss further. Osteoarthritis, or known as OA, this is often due to wear and tear of the knee joint and is age and activity related. Osteoarthritis may also be due to previous injuries of the knee as well as pre-existing malformations. This condition often affects individuals over the age of 50 years old, but with increasingly active lifestyle, even younger people may also be affected. Next is the rheumatoid arthritis. It's a chronic progressive systemic inflammatory disorder, which the joint are the primary target. It is a common autoimmune inflammatory arthritis. Women are also commonly affected than men, which is 2 to 3:1. Why is it so? Because woman produces hormone called estrogen. So when the estrogen drops around that time or menopause, it can also cause rheumatoid arthritis. Okay, and lastly, is gout. The inflammatory arthritis, which caused by the buildup of uric acid, will turn to crystal in the joint. So, character by unpredictable, intermittent, and excruciating pain and swelling in the affected joint. Okay, so let's try out our Q&A. So, what are the main differences between these three types of arthritis? So there are two differences, degenerative and inflammatory, as the previous slide. Okay. So next is the complication of arthritis. So the complication, the deformity, which is the abnormal alignment of the bones and joint, discomfort, the feeling of swelling, sore, aching, limited mobility, unable to function as before, or disability, reduction in productivity, unable to do activities such as even standing or walking, and poor quality of life, which is dependent for caregiver. So next I will pass to Amanda for the risk factor.
Okay, so now I want to ask y'all, do y'all know who are at risk? Is it just elderly, or is it any other factors that you think that are at risk of arthritis or aching joints? Can y'all type in the answer in the group chat? Anyone know? Okay, let me give you some answer. So some of the risk factors of arthritis is due to age. Of course, the older you are, there are some risk factors of having arthritis. Then if you have some injuries that you had in the younger days, then in the older, when you grow old, you might develop some risk of arthritis as well. Yeah, whether old or young, correct. So those people who do professional sport like wrestling do rugby those aggressive sports, right? Then they might have arthritis in the future as well. Then mostly those male, right, have a higher risk of developing the arthritis than the female. Then so for the males, right, they have higher risk of developing the gout arthritis than the female one in the rheumatoid arthritis. So then genetics there. So when your parents have arthritis, right, most likely your as children grandchildren they also might develop some arthritis also. Then unhealthy lifestyle, example, you drink alcohol you smoke then you eat a lot of high high purine diet, which is something that will cause gout, then you will have more risk of having arthritis. So then when you are overweight, right, it will worsen the osteoarthritis condition, and then overweight also will lead to gout development in the future. So all these, right, will cause aching joints when you grow older. So what is the treatment for osteoarthritis? You understand what is osteoarthritis, right? So some of the treatment that you can use to cure, not cure lah, just to manage osteoarthritis is number one, do some activity modification. So in the early stage, right, the sufferer will have some pain from the knee arthritis or the joint arthritis, right? So you all can do some activity modification. You all can eat some pain reliever medication and use all those non-surgical means. That means you can use heat pack put on your knees, then put on your aching joints to relieve some pain. But if in more severe cases, right, then you might need to do some surgery. So some simple procedure can be realignment surgery, joint replacement. If this is for the doctors to determine and then suggest to you some of the treatments that they think is suitable for you. So for rheumatoid arthritis, then it's a little bit different. Best is to do some exercises for those early stage one. The goal for this rheumatoid arthritis is for early detection and treatment. So you try to maintain your arthritis to a minimum lah. So some of the methods that you can use is do exercise, change your nutrition, have adequate rest. Exercise and the physical therapy, right, will actually benefit you and prevent long-term joint disability and the functional impairment so that you all can function well in the community. So nutrition, right, you can eat healthy diet. It's important to consume your high calcium diet because some of the medication that is used for rheumatoid arthritis, right, will reduce your calcium in the body. So you all need to top up. So you need to eat high calcium diet. So the disease process of the rheumatoid arthritis can be delayed by using the medication. So some of the medication is like your non-steroid anti-inflammatory drugs, can be like some corticosteroid and stuff like that. So all these things, right, is a doctor who will check your bloods, do some investigation, then they will give medication according to your body needs lah. So for those severe cases, right, then you'll need to do some surgery because some joints cannot be repaired already, so they might need to do some replacement and stuff like that. So it's for also best is for doctors to review your physical condition and then treat accordingly. So the last one is treatment of gout. I'm sure you all have heard of gout. So how do you prevent or manage gout? So of course you have to do some lifestyle modification. Try your best to manage your own weight. Don't let your weight, BMI to be overweight or obese lah. This one is to prevent your gout worsening. And then also to limit smoking and alcohol intake. And then best is to actually exercise to keep yourself healthy. Some diet modification will be good also to have a low purine diet, reduce the intake of red meat, your animal organs, the seafood to limit the production of uric acid in our body. And to keep your body well hydrated so that we can expel all the uric acid out from the body. And then to limit your sugary drinks and food because all these will increase your uric acid. So uric acid, right, will accumulate and then causes gout. So together with all these things, right, lifestyle modification and diet changes plus medication also, all these will help to bring down your uric acid, right? So your gout frequency won't happen so often. So of course, with those with very severe gout, situation, right? Also, doctor might suggest surgery lah. But I think for early cases, they will actually try to ask you to change your diet, eat medication, and exercise to prevent the gout from happening long. So what are the diets that is of different purine levels? So you can see from the picture here. So we will try to tell you that moderately eat, you know, those low purine food and medium purine food. You can eat, but eat moderately. Try to avoid those that is high in purine, which is your animal organ, your sardine, ikan bilis, lobster, fish eggs, all these all high in purine. So try to best to avoid this so that you won't have gout happening. So in summary, we have to prevent arthritis because this will limit your function. That means you cannot walk properly and all that stuff. So how to prevent it is to eat well-balanced diet and then drink a lot of water to flush all the toxin out, and then to keep a healthy lifestyle, stay active, and then have early detection and treatment. If you think that you have swollen joint, faster go and see doctor and see if it's gout or rheumatoid arthritis or is it osteoarthritis. So all these is not because you are old already, then it's natural, it's like that. So you have to go and see a doctor. Okay, so that's it for today. You have any questions for our health talk for today? Get on the news. Got volume.
May I check with you? If let's say you get your knee locked, is it also arthritis?
Knee lock and arthritis is different.
So what happened when you got the knee lock? Like you cannot move at all?
As in shoulder lock lah, knee lock lah, or because of maybe some sports that you might do or some range of motion that you might engage in. So they will actually, the doctor will actually see if it's an actual knee lock or is it something else.
So actually knee lock is not arthritis.
It's not a form of arthritis lah.
Oh,
yeah, but it will limit your movement in doing the things that you want to do.
But sometimes you get the stiffness also, right?
Sorry?
The stiffness?
Stiffness, correct. You will have stiffness in your joints.
So this is arthritis, only stiffness.
Daisy asked, what is knee lock? Can you all answer what is a knee lock? So knee lock, right, is the joint that cannot, like, you know, when we are healthy, right, then the joint can move, right? But then for knee lock, right, the joint suddenly cannot move properly lah. It only can like maybe move half of what your normal knee does. So what's the cause of that? We also like need to
Sorry, Amanda. I think she has a connection issue.
So what kind of diet can help to sort of prevent, or this type is like this, as you age, it's inevitable that you get this type of problem. You get my question? Yeah.
Yeah, sorry, Mike. Where did I stop? Because my internet just left. Don't know what's knee lock. Normally it's like that, right? Then normally you can move like 100%. So knee lock is just a syndrome that your knee just maybe 50%, 20%, 30%, but we don't know the cause of the knee lock. It's just a symptom. You need to see your doctor to check what is causing the knee lock. Is it because of arthritis, or is it because of tendon? Your nerve could be affected, your tendon is affected, it causes the knee lock. And if you know the root cause already, then you can what you call it? Do I need to see a doctor to check? Yes, of course, because we don't know what is causing the knee lock.
Is the deterioration of the bone mass?
Deterioration of bone mass means your bone density is very low, and it's not the low bone mass doesn't equals to knee lock. It's just that low bone mass, right? When you fall, then you're higher in tendency to get fracture and all that stuff. Your bone very brittle and might break easily lah. So it doesn't mean that low bone density equals to knee lock. Is there any other question?
Is osteoporosis part of this osteoarthritis?
Osteoporosis contribute to osteoarthritis, is it? Is that what you meant? So osteoporosis means your bone very brittle. Osteoarthritis means your joint. I show you the.
So are these two related?
Not really related,
Huh?
Not really related. One is joint, one is bone.
Oh, okay. So osteoporosis is bone, brittle bone. So arthritis is the joints.
Yes.
Okay, thank you. But it may each may lead to one another, right?
No, they usually come together lah. Not one. You have one means you have the other one. Yeah, let me show you the picture. Yeah. You can see, right? Osteoporosis means the bone here. But osteoarthritis
it's the degeneration of the.
You see my
joint,
one? Yeah. Okay, you can see my slide. 可以看到。Can see my slide lah?
Yes, we can, Amanda.
I saw.
Okay.
Yes, we can.
Okay. So osteoporosis affect the bone. Osteoarthritis is the joint. Okay. Any other questions you have?
Is osteoarthritis and arthritis the same?
What you say again? Osteoarthritis
and arthritis the same?
Arthritis is the whole umbrella. So arthritis have osteoarthritis, rheumatoid arthritis, and all those arthritis that we mentioned just now. Yeah.
Oh, okay. Because earlier on I didn't see the slide now.
Oh, okay. Then you can refer back to Facebook.
Hello, can I ask a question?
Yes.
Okay, my arm near the upper arm is very near to the shoulder, that part. It's very painful, especially when I wake up in the morning. So is this part of arthritis?
Your shoulder, your arm?
Yeah, the upper arm, our upper arm, the fat part there, the upper arm near the shoulder.
Near the shoulder. Very pain.
Yes, very painful. If you ask me based on scale of 10, it's 10 upon 10 or maybe 12, 13 upon 10, that kind.
Wow.
Yeah.
Then you need to see a doctor.
Yeah. I booked a date already. I haven't gone, but I will go for private physio first to see how.
Okay.
Yeah, but the pain is such that like early morning, I can't brush my teeth. I can't even flush the toilet because the moment I press my 2 fingers on the flush, the pain, it will cause a pain very severe. But the pain will slowly go off towards the afternoon, like maybe reduce to 7 or 8 upon 10, that kind. Yeah. So is this arthritis or whatever you call it, osteo or what, rheumatoid, or is it gout?
I cannot tell for sure because I didn't see you and I didn't.
Yeah, even if I go and see a doctor with his or her naked eye, she also cannot see what is happening.
Yeah, so that's why they will do tests, lor.
I go to TCM. What the TCM say is maybe is the what you call it, bicep what you call it, 二头肌发炎了. What is that? It's a bicep tendonitis.
Oh, tendonitis. Maybe lah, because I cannot tell you that it is rheumatoid or is it tendonitis because I didn't see you and I cannot tell. And then
yeah, you want to see me also can, but where to look for you?
I think you see the doctor first, and then they will do some investigation for you. Yeah. Then if you need more explanation, then you can come and find us in the community nurse post.
Are you at which block or where?
Where you stay?
Bukit Merah View.
Bukit Merah View. The nearest what block?
What block? 126.
126.
Is it I can go to UHealth?
Actually, if you would like to know about our community nurse post, what I would suggest in case of PTPA, then we ask you which store and all, you are afraid that you know, you're afraid others will know where you stay. Don't worry, you can always Google SGH community nursing. We have 39 community nurse posts shared in our website as well. So you can actually go find the nearest community nurse post near to your house and you check when is their operating hours. So like what Amanda shared, it's best for you to actually go see a doctor first, and subsequently you need a further explanation or further sharing by our community nurse. Then you can pop by our community nurse post and make an appointment with them. Then they will actually arrange a appointment with you to actually go through with you again on the
community nurse. Is it always at the youth health office? If there's the one, I will know where to go.
Sorry, youth health office?
Inside youth health, inside always got one community nurse. Is this a place?
Is it? Yong En?
No, youth health. NTUC youth health.
NTUC youth health.
Yeah. Is that the one?
I might not be familiar with this term. Why not later on I share with you our nurse post availability. NTUC Health AAC at Bukit Merah View.
Yes, that's the one.
Yes, then you can actually pop by to see our community nurse post there. Block 110, block 11.
Block 117.
Block 117. Okay. Yeah, we have one at NTUC Health. So they open at different timing.
Yeah. No, I know when they open, which day they open, I know.
You know, so you can actually make an appointment to see our community nurse from there.
But what can they do?
Depending on what type of help do you need. So like what Amanda shared, so you have seen a doctor already and you realize that I'm not able to manage my pain well, or I don't understand what the doctor actually meant. Will you be able to advise me further, or how else do you think you can support me after seeing the doctor? And our nurses will be able to advise accordingly after. If I miss anything, Amanda, and please add on.
Yeah, correct. So after you see the doctor, if there's any pain, you need to relieve some pain. You need to know how to relieve pain. Then we can advise you on this kind of thing, lor.
I think the most they will send me to go and do physio. That's all I think, and give me painkiller.
Yeah, lor. So we will review all these things. Then if you need more methods, then we can share with you also, lor.
Okay, can. Okay, thanks a lot.
Okay.
Thank you.
Any other questions?
So I want to know, is there the difference between osteoporosis? No, sorry, what? No, yeah, osteo. That means it's the what do you call that? Which is more severe?
Osteoporosis or what?
Or arthritis?
Which one more severe? It's just that different types of disease law. So they have different what you call this? Different complications. It's not whether this one more severe or that one more severe. So if you have osteoporosis, your complication is like when you fall down, then you will break bone or fracture bone very easy lah. Then I don't know which one you think is more severe for you. Then arthritis that you cannot move easily, you get stiffness in joints, then you wake up, then you cannot walk properly, you know, that kind of thing.
Okay.
Yeah. So I don't know. Yeah, it's just different complications.
So just can the rightful exercises help? Or diet, like you can like arthritis, I think you have to avoid beans, right?
Yeah.
Beans or those high calcium veggie must avoid also, right?
No, you must eat high calcium food lah. Cause all those
must eat. Only gout cannot. Gout you have to, because I heard lah, no true or not.
Gout
like
must
broccoli
avoid.
not suitable for gout, right? Broccoli and
Gout
spinach.
Gout must avoid those purine food, those like sardine, fish, fish eggs what you call that, animal organ, all that stuff lah. But then osteoarthritis, all these rheumatoid, I think you need to eat calcium supplements to strengthen your bones and your joints and all that stuff lah. So it's different kind of exercise is good for all of them, because the more you exercise, the more flexible your joints is lor. So once stiff already, you must really move to make it more, you know, like screw like that. You never move for very long, it gets stiffen, right? But you every time move, right, then it will be more fluid. Yeah.
Thank you.
So so that's useful. So Beverly asked, if the joint pain is one of the finger, is it arthritis? So it could be arthritis, it could be gout, it could be something else also, but I cannot tell you whether this is confirmed arthritis.
Yeah, talk about that. The triggered finger. It's actually the inflammation of the finger. So what can help? Exercise or what? Massaging?
So you need to find out what is it first. It could be tendon problem, it could be nerve problem, it could be arthritis, it could be so many things. So you need to see what is the thing that is the problem here. So if it's so if it's not
when we clench our fist, then the one finger cannot come out, must force it out. That is called, this is triggered finger, right? So how to treat or what kind of exercise is good?
Trigger finger is an issue involving the tendon lah. So you need to sometimes you need to rest it. Sometimes you need to eat a medicine to relieve the what? Eat medicine to what you call that?
Medication.
Sometimes the doctor will give you medicine for this. Sometimes you just need to rest. So you need to see a doctor first to see what is the best treatment. Then after that, when rest ready, you feel a bit better, then you exercise lor.
Because this one like mostly ladies who do a lot of washing a lot of washing they will cause this, right? This type of so-called triggered fingers, right?
I mean not only triggered fingers like we also have a lot of problem with our wrist, you know, when we wash, So all these things, constant movement of the same movement, right, will cause some straining of your tendon, your nerve and everything lah. So they will ask you to do some other exercise to release all these things and
physio, you mean physiotherapy?
Yeah, you can do some physio for this.
Thank you.
No problem.
Sorry, may I know what's the difference between osteoarthritis and rheumatoid arthritis?
Difference. So osteoarthritis, right, is a degenerative disease lah. It's due to wear and tear when you keep using it, and then old age already, right? Then you will get this wearing down of the joint. Then for rheumatoid arthritis, it's more of like autoimmune inflammatory. Something is attacking your joints, then it becomes inflamed and swollen. Yeah. So it's a little bit different in terms of what is the cause. Yeah.
Okay, thanks.
No problem. Any other questions?
You're typed up by degenerative, that means those that wear and tear due to old age. Inflammatory is due to like sudden what do you call that, breakdown, then you get inflamed. Is that what's the difference between the upper two?
Upper two, degenerative and inflammatory?
Yes.
No, just now what you said, degenerative is wear and tear. So when we go older, we keep using the joint, then it becomes like the joint wear off lah.
Oh, okay.
Inflammatory is like something attacking it, then it becomes swollen and inflamed and red and stuff like that.
Right. Oh, thanks.
Anything else you all have?
So today you all didn't touch on osteoporosis.
No, we are only speaking about arthritis today.
Okay.
You got questions about osteoporosis, is it?
Yeah, as what just now you mentioned, the osteoporosis, when you feel that when you fall down, your bone fracture, then you know that you have that, right? You have fragile bones. Other than that, what are the symptoms?
For osteoporosis?
Yes.
This one, there's no symptoms like I can see from my naked eye. You get what I mean?
Unless you go for a test, okay? You
correct.
Go for this test.
Correct. It's the bone mass density, then you know you have osteoporosis.
But then again, once your bone mass is low, the doctor will recommend you to take those pills. You have to take for how many years? 3 years at least. Why must take 3 years?
Why must take 3 years? I have no answer for this. Is the doctor what you call that? What you call it? Their own preference or their own judgment that they think that okay, this one you should eat until 3 years or something. If no cure, or like if it's not getting better, then they should treat something else maybe. I don't know what's their thinking.
But no, not at least 1 year lah. So long, 3 years is a long time. And this pill also interfere with your other medication, I understand, right?
What pills you are talking about?
Certain pills that you cannot take together, those people who have BP, they have cholesterol level, BP and all that.
Yeah,
so they cannot interfere, right?
Yeah, also depends on what medication you take. I don't know whether I mean, once you have the medication, then we can tell you whether it interferes or not.
But how to prevent it, osteoporosis?
That means right now, because when we grow older, especially women, we have menopause, we will naturally lose calcium from our bones. So you have to replenish it. You have to replenish it, like you eat the calcium tablet then like eat the drink milk.
Sad to say when it's been discovered, let's say after 4, and then you are being diagnosed that you're having osteoporosis. So it's sad to say it's like too late. By then it's too late. Because like for ladies, after the what they call,
That's why
menopause, you tend to get weaker, and then very easily you get that, and then it's too late by the time
that's why
so
we
it's like
always suggest you all to do early detection. That's why when we reach menopause age already, we will ask you all to do some tests, some health screening. Yeah, then you do the test, then then you can
prevention better than cure.
Once you test, then you know.
So calcium can help at early stage.
Yeah, to replenish all these things that you're losing, so vitamin D, go outside to the sun.
Yeah, go to the sun.
Walk in the park, that kind of thing. Regular exercise, eat healthily, vegetables, fruits. Yeah, all these things. Spinach got a lot of vitamin D also. Yeah, depends on individual. Yeah, correct. So some lose vitamin, some lose calcium more than the other. So it depends on individual.
But may I know if the poly subscribe those the vitamin D for the calcium one? I think this dosage of calcium inside is 400. Is it sufficient compared to when you buy from the private pharmacy? It's 1,000 mg,
1,000, yeah. Okay.
So, but the one the poly prescribed, the one is the calcium dosage is 400.
Mostly Suncal, it's called Suncal.
So is it sufficient or not?
So they will ask you to eat 2 tablets of 500 mg. The Suncal, right, is usually 2 tablets for you.
It's 400 mg. Is 500? I thought it's 400.
I think it's 500. I think it's 500 if I'm not wrong.
All this one I saw
is a very weird number. I don't know. Anyway, they will ask you to eat 2 tablets. So 2 tablets is also equivalent to the commercial one outside, which is 1,000.
Oh.
Yeah.
So is this the same? Is this as good as the private 1,000? Because I heard that some of them eating this they lead to what they call that what is called stone.
Cause constipation.
Cause stone.
Yeah, constipation.
Gallbladder stone.
Gallbladder stone.
Gallbladder stone. Is it true?
Must drink plenty of water. Yes.
Yeah, so you need to hydrate yourself and then don't eat more than the prescribed one. That means a commercial one, they only ask you to eat 1 tablet once a day. Then for the Suncal one, the doctor prescribed one is 2 tablets once a day. So if you eat only those prescribed ones, right, then sometimes when you all don't know, right, some multivitamins, then plus you eat the Suncal, right, all these multivitamin also got calcium also. So you need to read the label, see whether you are eating a lot of the same vitamin. You get what I mean?
Some even with magnesium.
Correct.
Supposed to be better, right?
So I have some patient who eat more than what was prescribed. Already doctor give you 2 tablets and then she eat multivitamin, also got calcium. So it's like a lot already. By right, your body can drink a lot of water, you can flush out all the excess one. But if not, then it's stored inside, then it's not good in your body also.
So plus this, if we add on to the food we eat high in calcium, the intake will be more than the 1,000 prescribed.
So 1,000 plus the food. The food is not that much until you will cause any issues .
Okay.
So yeah, you won't eat like a lot of spinach at one time also in one day. So it won't affect so much.
But not only spinach, your daily intake, your daily 3 meals a day, a lot of also other food also may contain calcium like milk. You drink milk also got calcium.
Ikan bilis,
Yeah, ikan bilis got a lot of purine. Don't eat so much. Later got gout.
Oh, ikan bilis got purine. Oh, okay.
Yeah, then inside the slide got say ikan bilis got purine, so don't eat so much.
So meaning what? Cannot eat every day, but it's okay to have it like twice a week, right?
Moderate yeah, moderate.
So what's that slide again?
The food, is it?
The food one, yeah, the one.
Here.
Yeah, there. Thanks. Wait, let me take a picture to.
So for us, healthy person, we just eat the food is enough to replenish the calcium. But then because you are losing calcium already, because you are approaching old age, and then plus your menopause and everything, you need more calcium. So with the supplement plus the diet is sufficient to replenish.
Well, I heard that a person lose calcium at the age of 35 onwards, you know, not at old age, you know.
When we usually benchmark, when we say you reach menopause, it's the rate of losing calcium is higher than the normal people. Yeah, so we will advise you all to take careful precautions when you are menopausal.
Okay,
so
I
the
saw, with this diet with different purine levels, so low, medium, high, and then that means we should balance it out. All of these three kinds must take also, right?
No lah, those high one you don't take very often. Those medium one you take moderately lor. Maybe 1 week can take 2-3 times, that kind of thing.
Oh, so low can eat more. You can eat more of the
every day
low one.
also can, doesn't really matter lah.
Oh.
Low ma. Water lah, water. You mean cannot drink water, man? I don't drink water. I thirsty already.
Like, okay, actually we're saying that as you age, you should not take much of the white rice. Should have brown rice or even purple rice or black rice, something. So is it true?
As in, white rice give you a lot of sugar.
Yes, so it's starch, like got that carbohydrate, right?
Yeah, compared to brown rice. Brown rice give you sugar, but in a very controlled, slower manner than the white rice.
Mix lah, usually mix lah.
Yeah, can mix lah.
Okay.
So may I know that when you say that, make sure that we all the intake from all the vitamins we take it's don't exceed 1,000. From if we take the multi-vit, when you look at the label, the calcium inside is known as what? Calcium D. I must look for the calcium. See whether any calcium inside.
Yeah.
And the dosage lah. Then I add up everything lah.
Yeah, correct.
Okay. All right. Then what about the neurobion? Do they have calcium inside?
No. Neurobion don't have.
Don't have. Okay. What is neurobion for?
For your nerve.
Not
it's
really
vitamin B.
For D is not calcium, right?
B for boy. Vitamin B.
Oh, B for boy.
B plus, good is it?
Vitamin B is to protect your nerves.
What about, okay, dark meat is red meat or white meat?
Dark meat,
This is actually a mix. It is actually known as a white meat, but then duck actually has very similar nutrients as a red meat. So there's still a conflict between white and red. But then if you have like some health conditions that that is related to it, it's actually have a higher nutrients content as compared to a red meat.
So it's white meat.
By right is white, but then I think there's still a lot of debate saying that it's red as well lah.
I recently just told, I was surprised because duck looks like red meat, right? But I was just told recently that it's duck and chicken are white meat, but should remove skin because of the fat. So I was surprised because I prefer duck to chicken. But of course I don't take frequently lah, you know. So then okay, now it's safe to take duck because in moderation, because you know I prefer duck to chicken, right? So the meat is quite. Somebody told me that duck is white meat, red meat because it looks red, right? But in the end, I just came to know that it's white meat like chicken, but must remove skin. That with skin.
Like I say lah, everything you eat must be in moderation lah. You know, water is good for us but too much water also will harm our body ma.
Yes, that's
so
right.
everything is in moderation, please.
For senior like us, 60 years and above, the best amount of water to drink is 8 glasses.
For in general, adults is to drink 7 to 8 glasses. But then we need to see whether we have any health conditions, yeah, like heart disease and all that stuff. Then the doctor will tell you to restrict your water.
Your 7 to 8 glasses, only just plain water, does not include your milk, does not include your soup.
Yeah, correct, water. But then if let's say if you have heart condition, then they will ask you to limit how much liter a day, that kind of thing, right? Then that one will include everything, your milk, your soup, your everything.
Oh, okay. Thanks.
Okay.
When you have some of this kind of problem, otherwise, plain water is separated as 7 to 8 glasses.
Yeah.
Soup not counted. Only we have heart condition, or then it could be inclusive lah.
Yes.
Okay, thank you. I don't have all those, but yeah, drinking water is I know very important.
Yeah.
But it's just like before food and after food, it just make a difference. You cannot drink too much. You affect your diet also.
Thank you, Amanda and Krista and everyone for all your questions. I like how we are able to have different topics, although we are talking about arthritis for today. We are coming to close to 3 p.m. already. So meanwhile, if you have one last question, you can actually, we will take in one last question, but meanwhile, maybe we can get the Gary to actually assist us with the QR code for your passion points first. Then you can actually collect your points, your passion points for now.
Thank you. Good enough.
So I guess everything like what Amanda or Christina shared today for your dietary intake is everything is in moderation. So not just say about oh, this is good, I should eat more, then this is bad, I should totally avoid eating. It is still okay to eat, but everything is in moderation is the keynote. Even the healthiest food, you overeat it, it will still cause harm to your body as well. Okay, sorry, Radima's team, are y'all ready to share the QR code with them? So for next week as well, we have it in the Mandarin version for today's health talk topic as well. So if you are keen to find out more, do join us for our next Monday health talk, which is in the Mandarin version. And also for those who have not signed up for our health talk, I understand that Radima will share with you the link, but if you would like to know for our upcoming health talk, you can actually sign up through our registration link so that you will know what's our talk in the upcoming months as well. Yeah. Other than that, is there any other questions? We can take in one last question while we wait for the Radima's team. Okay, seems like they are slightly busy as of now. So for those who are unable to wait, I think we shall end our health talk for today. So once again, thank you everyone for your participation. And thank you Amanda and Christina for sharing.
Thank you. See you next week.
Thank you very much for the talk. It's very helpful. Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.
Bye. I love you.
You.